In this show today, we're going to be speaking to a colleague of mine, Dr. Claudia Eppele, who I've known for years, and she does some very special things in her office. Has a naturopathic background, but she also treats patients with ketamine treatment. And she also treats people with TMS, which is a method of treatment that she will be discussing with us. Well, hello. Hi, doctor. This is Dr. Claudia Eppele. I had the pleasure of meeting you at a couple of conferences, and we had some really good discussions. And thank you for coming on my show. I talk a lot about medication, psychotropics, and I know you do that too. You're a board for certified psychiatrist, right?
I am not actually. I am a primary care physician who has dedicated to mental health over the years, and I've created a mental wellness center around it. And I work with psychiatrists and therapists, but I have trained psychiatrists over the years, as I have 50 years of experience with TMS.
That's why, and that's exactly why we bonded, because I'm a family doctor by training. And I basically have worked with mental health now for over 20 years, just that, and I gave up primary care many years ago. And so I think I like the fact that your background I think is fantastic, because I think it gives you a more broad view of things. But I was really interested in some of the things you're involved with. Some of the things I don't do. So TMS, which is transcranial magnetic stimulation, right? So you do that in your practice. So tell us about that. What does that consist? What is that, and how does that help people?
Absolutely. I'm going to apologize in advance because I have a little bit of allergy, so I may cough.
Fine.
Yes, TMS has been around for many, many years. It was created in 1985, somewhere in England, at the university. And I came across TMS 15 years ago. And it's a magnificent technology. I could not recommend it more. In my opinion, is the most holistic way to treat the brain, really, because it's going to the source. With medications, obviously, they're wonderful. They can help many, many people. But sometimes, unfortunately, they have side effects, and TMS has barely any side effects. It's extremely safe and extremely effective. So it can help patients with depression, anxiety, Parkinson's, dementia, ringing of the ears, tinnitus or tinnitus. It has many applications, and it's so safe. Like, why wouldn't we use it, right? That's where I was so excited when I first got trained 15 years ago. I loved it.
That's interesting. So with tinnitus too, that can help with that, because that's a very, very difficult thing to resolve.
It's a very difficult thing to treat. We today don't have very good therapies for it. No. And even with TMS can be difficult, because sometimes we have to trigger it before we make it better. And sometimes patients are already in a heightened anxiety state, and it can be very stressful, very, very stressful. So it's difficult to treat, but I had good success with it.
I've also I read that like OCD also can be really helpful with OCD also.
Absolutely, yes. OCD can respond by 50% with TMS, 50% reduction in their symptoms, which is significant for patients who really struggle with it.
Gives me an idea, because I have a patient, a woman with OCD, and I've only gotten her so far with medications, and I can't get her any better. So I think I might refer her to you.
I would love that. It's really, really a good treatment. And I think, like you said, sometimes they go so far. One of the things that we do with TMS is, unfortunately, we have to trigger them to really isolate those pathways and then treat them and break them apart. And we have to stimulate the extinguishing part of the brain to allow them to be able to let those thoughts or those compulsions go.
What is what are the magnetics? I know, because I know if people sit in a chair and they have like things attached to their skull, or is it like a magnets that are attached? And
Not really. It is a magnet. So it's a figure of 8 coil. Nowadays, there's many machines. Back in the day when I first started, NeuroStar was the only machine, or the first one at the time, and the coil was like that, very very ergonomic to the head. That was the very first one, and then as time went by, then people developed a figure of 8, kind of coil, like Mickey Mouse ears kind of thing, and it's mobile. You can take it everywhere and you can place it where it needs to go. It's not attached to the patient, it's attached to the back of the machine. And then you have the stimulation. Now, there's all kinds of machines. There's also BrainsWay. There are all kinds of machines. I don't mean to, just talk about one. That one has a helmet. They all have their pros and their cons. I think each machine sometimes gets better than the next one. But the principle is that magnetic stimulation. The patient needs to be put in the same position, and we do secure their head because we don't want them to move around. The treatment needs to go to the same spot. So as they come for the very first time, we're going to do some testing. We're going to do some measurements to know exactly where to go. In my practice, not everybody does this, but in my practice, I do a scan, an EEG scan, QEEG scan to really assess how their brain is wiring. So that allows me to see which areas are overactive or underactive, and I can customize the treatment for them. And then we also do a cognitive test as a baseline. And then after we do TMS, we repeat those parameters. So we have a very objective data for the patient's improvement. Once we have them ready to start, we do a series of measurements. And once we've decided where we're going to go, then we do a test in the motor area, the movement area of the brain's little back, where we treat the patients and we stimulate with magnetic pulses to reach the hand. We want to know that for sure 100% we're reaching those neurons, and that movement gives us that certainty that we are reaching the neurons at the time, and then we move forward to the treatment area. Like I said, we can treat depression, anxiety, OCD. There's all these protocols, and each of them has a specific frequency and parameters, and they're different from each other, and the locations might vary as well.
So are the waves, are they kind of restructuring the neurochemicals, or what's actually going on in the brain when this is happening?
Absolutely. To me, that's what I love TMS so much, because it's a very complete treatment. Mm-hmm. When we treat patients with medication, there's a discrepancy. There's an imbalance of the brain with the neurochemistry, right? So the medication is going to come and compensate for that lack of neurotransmitters. Sometimes we have to switch from one to the other. With TMS, we're stimulating the neurons to actually activate themselves. And once we activate the neuron itself is going to produce the neurotransmitters to communicate with other neurons. So you're activating the neurons that are underactive, and they themselves produce the neurotransmitters. So it's the most complete, most natural way to do it, because it's the brain producing what is lacking.
So, and it's fairly involved. I know time-wise, isn't it like 5 days a week for 6 weeks or so? Is that the standard?
6 weeks is a total of 36 treatments.
Okay.
I've been doing, most practices might do it this way, because I've been doing it for so many years. We have modifications of the protocol as needed, based on each individual patient. So we may have a course that is a little shorter. We might stack treatments in the same day. There's different ways of doing it, for the benefit of the patient. We try to customize it to each patient. Even when sometimes they're coming from far away, they can only come a few days, then we might give them more treatments in one day. Maybe they work, maybe they're here for college, they're just visiting for the summer, so we can actually give them a full course and be creative.
Now, getting this covered, I know it's not cheap either. So getting that covered on insurance, is that difficult?
With centers that are experienced with it, I think not. We rarely get denials. Obviously, the patient has to be qualified first.
Right.
There's a guideline that the patients have to go through before the insurance covers the therapy. But in general, if patients have failed 2 to 4 antidepressants, it used to be 4 antidepressants. Now, most insurance companies have dropped it to 2 antidepressants, except one company. And they also require 2 augmentations. And for people who are listening and might not know what augmentations are, an augmentation is a medication we add on top of the antidepressant because the antidepressant is not enough. That's an augmentation, something for sleep, something for anxiety, something for attention deficit or whatnot. Those count as augmentation. So we are very experienced with insurance processes, and we know each company, the guidelines or their requirements. And once the patient is ready, it's not a difficult process to go through.
So augmentation could be Wellbutrin, mood stabilizers, the atypicals.
Absolutely. They usually want a different class medication. Right. So if they didn't get improved with an SSRI, then let's try an SNRI or something else. Right. And very good news for people to hear is that Medicare actually covers, and they only need one medication. If they didn't get better with one medication or had side effects to 2 medications, they qualify for TMS, which is great, fantastic news, because older people, elderly patients usually have already medications, and we don't want to bombard them with a lot of medication. So we thank the insurance companies because they actually follow the doctor's recommendations, which is if you fail one, TMS should be next.
What's your success rate? I mean, I'm sure. I mean, nothing is 100%, obviously. What kind of success rate do you see?
Yes, we wish it were, but we have very good numbers because we implement a lot of, like I said, testing and mindfulness and therapy. We do neurofeedback. We do a lot of things for the patient. We have about 85 to 90% effectiveness. Wow. And yes, we do really, really well. In our center, we have a lot of things to offer in addition to TMS. And I believe in going to the source of where they are in the first place and help them decrease medications over time by really processing the issues that they might come with. Otherwise, if we don't do that, if we don't process that, that's always going to be an issue for them. So we really, really try to get under the hood and look everywhere. We also do hormonal optimization because a lot of these patients, they're struggling, but their problem is really hormonal. Very common in menopause, women start to struggle. They have anxiety, they may have depression, and they need hormonal replacement, not antidepressants. Right. It's very, very common. They can't sleep. Now they're on a sleeping medication when what they need is progesterone. You know, there's a lot of hormones that take place. Men go through andropause as well. Testosterone drop, some anxiety with that. So hormones are very, very powerful. So I try to really, really evaluate everything. And once we have them at their best, then that's how they feel better.
With men, I call it menopause or midlife crisis. So
crisis for sure. It does not feel good.
Yeah. So how often do they, so can this be like a permanent cure, or do they have to get tune-ups occasionally?
Yes, tune-ups are very common. With the EEG that we do and the scan that we do, we have a way to see really the voltage of their neurons and where they are in that dial, what percentage of those neurons are really active and which ones are not. We can almost predict. Some people come on empty, and one course might take them to 50 or 60%, but they might need a little bit more. They already feel better, but 4 or 6 months later, 2 or 3 years later, they might need another course, so they would benefit from another course. For some people, one course is it. They're wonderful. They might not need too much, and this can last many, many years. So everybody is a little bit different, but it's not uncommon, and especially because people feel better. Especially the elderly, they're undergoing memory issues, a little bit of atrophy and whatnot. When you give the brain what the brain needs, their cognition, we see it in the cognitive test. Normally, as we age, we go like this. After they do TMS, their cognition and their memory does that. So sometimes for the elderly, they just want to do it once a year, once every couple years, and then they boost their cognition. It's a very wonderful therapy, and it's very safe.
My understanding is it doesn't work that well with psychotic disorders.
A little bit different.
Yeah.
It can help with the hallucinations, with the auditory hallucinations, especially.
Right.
If there's a specific area that we treat and is helpful for that.
Right.
We can also treat patients with bipolar, not through insurance because the label is not approved for that yet. The insurance cover for depression and OCD, bipolar, not yet, but via cash, we can treat them, no problem. And we can treat, it's a very different protocol.
Yeah.
It can be beneficial.
Yeah, I've seen some really good results with some of my patients with TMS, and what I tend to do is I work pretty quickly with psychotropics and to get the results. Yeah, I do quick work, but if I get to the point where I've done what I've done and I've augmented, I've tried different things, and I'm just not getting results, that's when I would probably think about it.
Yes, it's nice. It will allow them to do better in therapy.
Right.
It will allow you to really play with the medications differently going forward too.
Yeah, I like the idea. I like the readjusting neurotransmitters and neurons. I think that's exactly what we do. Tell me, you also do ketamine treatments?
We do esketamine, which is a nasal spray. Spravato is also covered by insurance.
Mm-hmm.
And this is a little bit different. It has some advantages in the way of time. It's not every day. It's 2 times a week for 4 weeks. So it's only 8 treatments a month. And then the next month, they do 1 treatment a week. And then after that, we can do a maintenance phase where they can do it twice a month, once a month, still once a week if they need to. It's very effective as well. The patients can come out of depression quickly. Unfortunately, doesn't be as sustained. Sometimes they might drop, but it's a wonderful therapy to get them out of depression quickly, especially for patients that have suicidality. They're not feeling well. In a week or 2, they might experience benefit. So it can be a very wonderful therapy. And if they're guided properly, it can be a self-exploratory experience for them. They're able to see themselves from a different perspective. They're able to make significant and profound connections with themselves and their trauma very quickly. I have patients who have been in therapy for years, and they've done a course of esketamine or Spravato, and they advance very quickly in a matter of 2 or 3 months, very, very quickly.
Right.
And another thing that I've noticed with these patients is that people who have addictions, or they use marijuana or whatnot, they stop. They usually don't want to continue. Their anxiety gets better. People with OCD also do better. It's important that they're properly guided, because it is a process. It's a process. They need to be properly prepared. I don't know how much you know about it, but it could cause a little dissociation for patients. So you have to prepare them for that. Some people are very comfortable with it. They could see bright colors. They could feel they're floating. They might have an out-of-body experience and whatnot. But as long as they're prepared and they know they're safe, there's always a staff member with them. We monitor them for 2 or hours, 2.5 hours if necessary. The medication can make them a little sedated. Mm-hmm. This is a medication that was, is still used for anesthesia. So some people do feel sedated, some people do not. And that's why we ask them not to eat 3 hours prior, because they could throw up. We ask them to have someone to drop them off and then pick them up. And during that time, the medication is in, the medication is out, but during that period of time, they can have very significant realizations. And eventually their depression improves.
Do you do IV in the office at the beginning or no? Or you just do nasal spray?
We're going to do intramuscular soon as well. It can be also very, very effective.
Okay. You start with the Spravato with a nasal spray then?
It's a little, it doesn't have as many side effects. We find it to be very, very safe. And the advantage of being covered by insurance, I think it appeals to a lot of our patients. We always try to help our patients as much as we can through insurance. Right. Ketamine IV can be expensive, and sometimes, obviously, I don't think ever covered by insurance. Right. So it's a good alternative. But the intramuscular can also be very, very effective. So,
do you deal all with psilocybin or not? Not yet.
Well, actually, I've had a few patients who have done it. Unfortunately, it's not legal yet, so I cannot get myself involved with it. But I've had patients. I know patients who have done it, and they have had fantastic experiences. I know, if anyone is interested, I know someone a therapist actually who does it and does a very good job with it, and is properly guided and monitored. And every person that has done it has told me magnificent, wonderful things. They've had a wonderful process, and it brings out a lot of things that you might need to process at the time. Right. So it seems to be very extremely promising.
I saw one guy. I'd done what I could for him. What I did with him, he got a lot better, but just never was quite there yet. And he'd already tried TMS. It worked, but then it didn't work. He tried again, it didn't work. And he tried ketamine, and that really didn't work. And so he came and saw me, and his wife came in with him, and she said, he's better, he's stable, but she said, look at him, he just doesn't have the spark in his eyes. There's no spark there. He's just like, his eyes look dead to me. So I told her, I said, well, you tried all these other things. I've heard about psilocybin. I don't know anybody who does it. I said, but you can look into it, and you can look online or whatever and look into it. I saw them back a couple of months later, I think, and she had found a psychologist that works with it. And she says that, they do therapy with this guy, and and then she came back with him, and she goes, look at him, the spark's back. And I looked at him. True, you could see it. That's he had a smile on his face. And she goes, he's playing golf with his friends. He's playing cards with them. He's outside. He's doing things. He's active again. So it was really dramatic what I saw there. And I thought, well, there's definitely something there. But I've seen the same thing. I've seen things, people, with what I don't do, like people turning around with TMS, people turning around with ketamine. So some of these newfangled treatments are pretty powerful, really.
Absolutely. They're very powerful. And I think have few side effects.
Right, exactly.
They're not going to have weight gain. They're not going to have any of these things that, usually makes their depression worse. Right. And like you, I've had experience with the psilocybin. I had, people that I've known who were struggling as a couple in therapy for a while, and all of a sudden they do this and they recognize each other at their essence of what it is that their love and whatnot, and very powerful that they still remember the experience. I had a lot of patients that, not a lot, I shouldn't say a lot because I had a few that have had very good experiences. I think we shouldn't discount those therapies, and I think eventually they will be legalized. Because of the impact that they're having. I don't think it's going to take long. Yeah,
I've heard the same thing. So excellent. Well, could you tell our audience where they can find you and your contact information and where?
Absolutely. I'm Dr. Claudia Eppele, and my practice is TMS Health and Wellness. That's how you can find us online. Our phone number is 855-867-5551, or you can email one of our staff members, bianca.m@tmshealth.com. tmshealthandwellness.com.
Excellent. And are you anything that you're doing on either podcasts or social media? Anywhere else that they can follow you?
I've always been scared of it. I don't even look at my reviews as a policy. I am scared of the internet. But I think I'm going to start to do some YouTube videos, and I'm going to start dipping my toes in it, because I think it is a great vehicle. And I think there's a lot of information that we can really transmit to people. And, I think it's worth it. I will still look the other way. I probably won't look at reviews. But yes, I'm going to start soon.
Great. So Dr. Claudia Eppele, TMS Health and Wellness. She's in Costa Mesa, California.
California, yes. Sorry about that. Very close to South Coast Plaza.
Yep, great, nice area. So thank you so much for coming on. I really appreciate it. It's a pleasure.
Thank you so much.
I'm sure I'll see you again soon.
And congratulations on your book.
Thank you so much. I appreciate it. Yeah, the book's going well.
Thank you.
Thank you. Bye.